Welcome back. Well, discussions about mental health are important and should be encouraged, but it seems like there's still some stigma around the subject. How can we end the discrimination against people suffering from mental health issues? Let's find out now from psychiatrist Dr. Frans Korb. Dr. Frans, thank you so much for your time this morning. I was reading the statistics saying that the global prevalence of anxiety and depression increased by 25% in 2021. However, in the South African context, we saw an increase of 36.4%. That is in South Africa alone. It says something about us being able to pay attention to our mental health, and particularly looking at the fact that post-COVID-19, mental health has been deemed as the new pandemic.
Yeah. Jana, thank you very much for having me, first of all, because as you said earlier, I mean, tomorrow, the 10th of October, is World Mental Health Day, according to the World Health Organization. So it's really so important that we address this topic. I think especially in South Africa, where, like you say, and especially with COVID, we know that the incidence of depression and anxiety increased worldwide at least by a quarter, by 25 to 30%. So, you know, and in some of the kind of articles that has been appearing in the academic press, they almost say that now post-COVID, after the COVID pandemic, we will now have this tsunami of mental health problems hitting us. And I mean, the statistics in South Africa is kind of staggering. I don't know if you know that last year, the World Health Organization also released their suicide statistics worldwide. And South Africa, I don't know if we can call it the privilege, that we ranked number 10th worldwide, or the 10th highest in the world of suicide.
Sure.
So, you know, that the whole thing about mental health in South Africa is just so incredibly important that we address these issues.
Yeah, but I wonder how much stigma plays a role in us not being able to effectively address this issue, and just some of the assumptions that may be incorrect about this, about mental health.
Yeah. I mean, if you look at the whole topic of stigma, and you know, I'm part of SADAG, I'm sure you know that, the South African Depression and Anxiety Group, and also the Society of Psychiatrists in South Africa. We've been trying, and we've had committees, we've had working groups addressing the whole problem of stigma for many years. But stigma is a very, very difficult topic, because it's not so easy. It's not one thing you can do to eliminate it, because if you look at stigma, there's various parts to it. First of all, there's what we call social stigmas. Now, social stigma is that thing where it's the kind of how society interprets mental illness, what they think about mental illness. And unfortunately, it is rooted in so many wrong kind of perceptions and you know, the behavior towards people with mental illness. So that's social stigma. The second one we look at is what we call self-stigma. So the person that suffers with mental illness then listens to what society say, that if you've got mental illness, you're a weak person, you're not a strong person, you're going to do something wrong, you're going to be violent, you're going to hurt somebody. So then the person with mental illness kind of internalizes that kind of stigma. And then the third one, of course, there's still professional stigma. Unfortunately, medical professionals that still don't understand or how to manage the stigma. And then I think the fourth one is what we call cultural stigma. So that is how a culture or a society and kind of interprets what mental illness is all about. So when we tackle mental illness, one has to look at all four of these aspects and change them, which is really not easy to do. So, and unfortunately, in our society, there is still a lot, and I work in practice part-time on my own in private practice, and then a bit in government service. And it's unbelievable the kind of misinterpretations that we still see on all levels, what mental illness is all about.
You know, Dr. Frans, so we partner up this issue around stigma with now the lack of mental health services in this country. And you have to look at public hospitals, for example, how much patients have to wait before they can get somebody see them or a specialist see them and be able to diagnose their mental health issues. And sometimes we find that civil society is falling by the wayside simply because, public hospitals and public healthcare facilities don't have the capacity to be able to deal with this crisis, especially given the number of practitioners which are in the public health space.
Yeah, that is frightening. I mean, I got a statistic from SADC last week, and the SADC statistic they gave me looking at mental health services in South Africa, and the stats they gave me was that only 5% of the national health budget in South Africa, only 5% goes towards mental health services, which is shocking. I mean, 5% of the whole health budget is for mental health.
Sure.
And, mental illness is not those kind of things that you take a pill for 10 days, like an antibiotic, and then it's all over. Most mental illnesses needs to be on kind of long-term treatment. And exactly what you say now, people get treatment, they go to a clinic, they get treatment, they can take their medicines for a month, next month they go back to the clinic. First of all, they have to sit there 2-3 days in a queue to get their medicines, and they get in front of the queue, and then they don't have medicines. And then they have to come back a few weeks later because only then will they have medicines in the clinic. So, and that stop-start kind of medical treatment really makes mental illness much worse.
I hear you, Dr. Frans. We have to leave it there, and unfortunately, time is not on our side. But what you've said is quite insightful. More than anything else, it lands and gives us something to think about in general society. I hope that government is listening to this conversation. Dr. Frans Korb, a psychiatrist, giving us the latest on Mental Health Awareness Day that is happening tomorrow.